The following program is brought to you by the Center for Educational Outreach at Baylor College of Medicine.
Hello, my name is Lawrence Crum. I'm a professor at the University of Washington, and I'm also the team leader for the Smart Medical Systems team of the National Space Biomedical Research Institute. And I would like to tell you something today about an evolving new technology that I think is of great interest not only to NASA and NSBRI, but also to society in general. We call this therapeutic ultrasound, and I will go over some discussions of therapeutic ultrasound, talking first about the history and background, some basic principles, and I'll show some examples of the use of this technology in a clinical area. The topics that I will discuss are thrombolysis, lithotripsy, and tumor ablation, although there are many applications of this technology in a variety of different areas. I'd like to talk first of all about some history. Most of you probably are aware of the use of diagnostic ultrasound. In diagnostic ultrasound, one uses a pulse echo technique, something like sonar, to send out a pulse, have it reflected, and use that reflected pulse to form an image of the issue that is being illuminated by the ultrasound. I show here a picture of gallstones that are illuminated by the ultrasound imaging system. You're probably much more familiar with images of the baby's first picture or something like that, but technologies that can see gallstones are revolutionary technologies, and previously, before the application of imaging, ultrasound imaging to clinical medicine, gallstones were detected only by the symptoms that they displayed. Yet, sort of about 9 out of 10 people who have gallstones do not show these gallstones until they're symptomatic. Another image that's of use, or another application, is to see the blood vessels in a particular area. And I'll show you later that with ultrasound you can see these blood vessels, and this enables us, for example, to treat blood vessels that might be bleeding. The typical image that one sees of use of ultrasound is a baby's first picture. And now this is becoming quite the rave in terms of movie stars and so forth, seeing their preborn child. For example, Tom Cruise purchased a $250,000 ultrasound imaging system so that they could see their first baby. This imaging ultrasound was developed in the 1960s. And it wasn't until the 1970s and 80s that it really became a complement or a component of modern clinical medicine. What really became first, or what came first essentially in the use of ultrasound in medicine, was some developments by the Fry brothers, 2 physicians at the University of Illinois in Champaign, who actually used ultrasound for therapy. Now, I will talk about ultrasound later for use of therapy, but it never came into vogue until just recently. So it was, though, one of the first applications of ultrasound in terms of clinical medicine. It's interesting, you might note that the Office of Naval Research supported this research. You might wonder why ONR was interested in supporting such research, but this technology treated Parkinson's disease, and Parkinson's disease, before they developed drugs to treat that, was a very important part of a very difficult disease to treat, and it was very commonplace in the 1950s. Here is a figure from Samir Midagotri, who wrote an article in Nature Reviews showing the many, many applications of therapeutic ultrasound. And I'll allow you to look at this in some detail at your leisure, but starting at 20 kilohertz and going essentially to 20 megahertz, there are probably 25 or 50 different applications of therapeutic ultrasound. And I couldn't cover all of those in a simple lecture, but it's important to recognize that this is not a completely new technology. This is a technology that has widespread use, and it's probably not familiar to many people. But within the technical community, there are lots of things going on in therapeutic ultrasound that have great promises for medicine. And I would like to go through a few of these now and talk about those in more detail. First of all, let me give you some background about therapeutic ultrasound in comparison of this technology with other technologies. It might be interesting to note what the acoustic waveforms are that comprise these different technologies. So for diagnostic ultrasound, one typically has a pulse echo sequence in which one shoots a small pulse into the body and then waits a time period until that pulse is reflected. And you use that reflected pulse to form an image of the area that's illuminated. So these pulses are typically quite short, on the order of a microsecond or so, and they're spaced apart a considerably long time with respect to the length of one pulse, say on the order of 200 microseconds, 200 times the length of the pulse. So one can say then that some measure of the intensity of the pulse is in the order of 100 milliwatts per centimeter squared as some unit. Now, because one uses ultrasound to look at very fragile systems, such as a baby or a fetus, then one has to put restrictions on the amount of energy that's applied. And so the Federal Drug Administration restricts the use of these pulses, or the energy associated with these pulses, to a few hundred milliwatts per centimeter squared. So this is to ensure the safety of these devices. And let me compare that with the technology of therapeutic ultrasound, similar to the one you saw with the movie of the Fry brothers. In this particular case, the pulse is no longer 1 microsecond, but let's say on the order of 1 second, a million times longer. And instead of waiting 200 times the time between pulses, one waits on the order of the same amount of time. So it's on for 1 second, off for a second, on for another second, and so forth. As a consequence, the total intensity, or let's say energy applied, is almost 1 million times larger. So, but in this particular case, we're interested very much in having a therapeutic effect or a biological effect. Another application is lithotripsy. In this particular case, one has a pulse that only lasts for a few microseconds. Instead of waiting for, let's say, 200 times, one waits for an entire second before the second pulse comes in. Indeed, if you do not wait for a full second, these two pulses interfere with each other. So the intensity is on the order of 1/100th less than that of diagnostic ultrasound. On the other hand, this lithotripsy pulse actually causes stones to break within kidney stones to break within the kidney. And the reason for this is that the amplitude of the pulse is extremely high, on the order of 1,000 atmospheres of pressure. So this sort of comparison of parameters and background information, I think, is useful when you start thinking about the applications of these technologies. Let's talk about an application of ultrasound in a very important clinical problem. The leading cause of disability in the United States is a ischemic stroke, or strokes in general. 90% of the strokes are ischemic strokes. And this results from an occlusion of an artery, typically the midcerebral artery in the brain, and then the brain is starved from blood, and so therefore sort of shuts down part of your body. And of course, most of us know someone who's had a stroke and so forth. So this figures here that you can see on the screen show a midcerebral artery that is blocked by an occlusion, a blood clot. We call that an ischemic stroke. So how does one treat this particular problem with ultrasound? Well, in a company that I was involved in starting in the Seattle area, one can develop a small catheter that has on the tip of that catheter a little transducer. And in the middle of that catheter is a lumen or a tube. And so with that tube, this catheter, you can very aggressively treat the stroke by passing this catheter through the vascular system. You might go in through the carotid artery or another artery, perhaps even the femoral artery, reach the occlusion in the brain, and then supply to that particular clot a thrombolytic drug, that is, a drug that would dissolve the clot. And people do that, but it doesn't work quite that well because the clot, the drug that's put into the clot, sometimes doesn't diffuse through the clot. And so what we've done is put this little ultrasound transducer on the tip of that, and you see now in this next figure where the ultrasound, once it's illuminated, causes very much more rapid diffusion of the drug into the clot. So, in a sense, to review then, a typical clot in an artery is shown in this figure, and if one injects systemically, let's say, into a vein or something, this thrombolytic drug, it will slowly diffuse to the clot. And of course, if you have a stroke and you can talk, the best thing you can do is to say to the physician, give me TPA as quick as possible because that's a thrombolytic drug. But typically, if that vessel is completely occluded, then there's no way that blood will supply that TPA to the clot. And then if it's completely occluded, you probably couldn't talk, but maybe you could have someone tell you a little message in your pocket. Use ECOS's catheter. If they have it available, they probably would anyhow. But this catheter then is inserted into the clot, and the TPA, the thrombolytic drug, is then delivered into that clot, and one has a very much more rapid dissolution of that clot. And here is an example, a case study, of a 64-year-old female that had a total occlusion of the right mid-cerebral artery. This condition would have resulted in almost total paralysis of the right side of this person, the left side of this person's body. But after 60-minute treatment with this ECOS catheter, complete perfusion or complete removal of the occlusion occurred. As a consequence, this woman suffered absolutely no long-term effects. It was almost like a miraculous cure. So this is a very impressive technology, and it is useful in a sense, and it is innovative technology using therapeutic ultrasound and probably has a lot of applications in the future. I might mention also that one does not need to do this invasively with a catheter. A lot of research is going on now where one is actually putting transducers on the side of the skull and irradiating through the temporal window and causing the same thing to occur with non-invasive technology. So listen, if you're interested in this technology, to see how these new technologies come to treat these conditions that are the most debilitating condition that we have in healthcare. I want to move now to another application of therapeutic ultrasound, that of lithotripsy. Litho means stone, and tripsy means to break up or to comminute. And there are approximately 1 out of every 100 people in the United States that get a kidney stone sometime in their lifetime that becomes symptomatic. And about 1 out of every 10 actually get a kidney stone that becomes non-symptomatic. So if there are 20 people in your classroom, probably 2 of them have a kidney stone already in their body. It just doesn't become symptomatic. Historically, one can find, at least from Wikipedia, and that's sort of our knowledge base nowadays. From Wikipedia, you can find that Peter the Great died from a kidney stone. And whether this is true or not, at least anecdotally, it's an interesting story. So what do kidney stones look like? Well, they go anywhere from a few millimeters to a few centimeters in size. And they are concretions that result from deposition of calcium, basically, into the kidney. And if the kidney is removing calcium from the blood, then these things can, instead of being passed through as a dissolved calcium, they can actually crystallize or calcify and become stones on the order, real stones in a sense, on the order of a centimeter in size. It turns out, of course, that astronauts do lose a lot of calcium when they're in space because they don't stress their large bones. And so there have been several incidents of kidney stone formation in space, and anecdotal information that one of the cosmonauts got an impacted stone, as it shows in this next figure. So these kidney stones form in your kidney, and typically they shake loose and pass through the ureter and urethra and go into the bladder and go out through your normal system without your knowing it. But occasionally someone gets a kidney stone that impacts in the ureter, and if it totally impacts there and occludes the ureter, then this can be a life-threatening situation. It is a common statement to say that the closest thing that a male can experience to childbirth is the passing of a kidney stone. And if you've ever done that, then you can relate. So what about this condition then? Let's suppose that someone is going to Mars or the Moon and having an impacted or an occluded kidney stone, an occluded ureter. How could one treat that? Well, on the Earth, we have these enormous systems called lithotripsers, in which one usually lies on a table or bed, and shock waves, very intense shock waves. Recall that I mentioned earlier that these shock waves on the order of a few microseconds in length, but they could be 1,000 atmospheres in intensity. We would say that would be 1,000 bars or 100 megapascals. So those shock waves then are transmitted from a shock wave generator through a liquid that in which it's generated through the surface of the skin into the kidney stone, and they tend to break up the stone. This figure here shows a typical kidney stone, maybe about a centimeter in diameter, and after a few hundred shock waves, these stones are broken up into small enough pieces, usually less than 2 millimeter, and then they pass through the body in a normal urological or urinary removal. And this is a revolutionary technology. It was essentially approved by the FDA without almost any clinical trials, because about 1 out of every 1,000 surgical operations resulted in death, and there are over 100,000 people who have lithotripsy operations every day. So there would have been 100 deaths a year from just the surgery alone. And so this is a very important revolutionary technology using ultrasound to non-invasively break up the kidney stones. I mentioned earlier that because astronauts in microgravity do not stress their large bones, they tend to dump calcium very rapidly. In fact, typical data indicate approximately 1.5% of the bone mass a month. And so a lot of this calcium is dumped through the kidneys, and if one is indicative or one tends to have kidney stones, then these kidney stones can form in the kidney in a short period of time. And so the National Space Biomedical Research Institute has funded a project in my own laboratory to use ultrasound to find ways of breaking these stones. Now, we can't take a lithotripter to space. They fill a small room, and they probably weigh a few kilotons. They weigh 3,000 or 4,000 pounds. So we have developed, along with our colleagues at the University of Tokyo, a small handheld, maybe the size of a softball or something like that, device that could break up the kidney stones. And this uses two frequencies. And it's a very interesting, I think, application of ultrasound. Professor Yoi Matsumoto at the University of Tokyo conceived upon the idea of using two frequencies. One, a high frequency to generate what we call cavitation, and then a low frequency to cause this cavitation to oscillate and collapse so that one could generate extremely large intensities by the driving of these cavitation bubbles. It turns out that lithotripters work by causing the shock wave to break the stone into pieces by the direct application of the shock wave itself, and cavitation probably plays a minor role. But in this particular application, one can use this particular combination of therapeutic ultrasound frequencies to break up the stone. I'm going to show a movie now which is shown by these figures on the bottom. So the figure on the bottom left shows the sort of cavitation field that's generated. The figure in the middle is a real kidney stone, a staghorn stone. These are the typical ones that form in the kidney and do not leave the kidney immediately because they tend to collect in the collecting area of the kidney. And then the figure on the right shows the application of this two-frequency system that tends to debride the stone like sandblasting. And so this movie now, rather complicated, but here's the two-frequency transducer that shows the high frequency in the interior and the center of that transducer, and the low frequency on the outside. Now let me demonstrate first of all that if one just uses the high frequency on the order of 3 megahertz and say 150 or 175 cycles, that very little occurs in this phantom stone that occurs to the right. Now I'm going to turn on the high frequency, and one will see that small little plume of sandblasting occurs from that kidney stone. Now consider the low frequency by itself. Now the low frequency is only 2 cycles at about 540 kilohertz. If we do the low frequency by itself, 2 cycles, these pulses are separated by several milliseconds. Now one sees very little effect, again, on the stone, perhaps a little bit more, but not very much. Now, Professor Matsumoto said, let's conceive of the fact that if we take the high frequency, we will generate a bubble cloud, and then the low frequency will cause that bubble cloud to oscillate and collapse, and we should get a much stronger effect. And now I turn on both, and you see this very remarkably different effect. I think this is a remarkable example of what a very bright bioengineer can conceive in his own mind and then give his graduate students to say, demonstrate this technology. It was very impressive. Well, you can see we could use this technology then, because it's lightweight and portable, to actually cause stone comminution in space. Okay, the third application of therapeutic ultrasound is an area that I'm very interested in myself because we have many applications of this technology. That's the idea of focusing high-intensity focused ultrasound in the same way that a magnifying glass would focus electromagnetic energy. You can envision, perhaps when you were young, or perhaps when you're not so young, that you've taken a magnifying glass and captured the rays of the sun, focused them on a small spot, and caused a piece of paper or a leaf perhaps to actually ignite into flames. So the same thing can be accomplished with acoustic waves. One can focus them down to a small point and cause temperature elevation at the focal spot. If you were to model what is required and you use high intensity focused ultrasound, then the kinds of intensities that are easily to generate with a simple little transducer of a few centimeters in diameter, can generate temperatures of 70 degrees within a few seconds. And you can do this only at the focus of the acoustic system. Now, I'll demonstrate this with this next movie. And in this particular movie, this is a bovine lens, the lens of a cow's eye. And we are focused the ultrasound from the right into the center of the lens. When the green light comes on, the ultrasound will come on, and we can count to see how long it takes for this high-intensity focused ultrasound to cause denaturation of the tissue. So when the green light comes on, I can count 1,000. You see, within perhaps 1 second, the focused ultrasound has elevated the temperature at the center of the focus to approximately 70 degrees, and we've denatured the protein. And in a sense, we have cooked the collagen of an egg. The same sort of thing. If you cook an egg, it turns from a translucent type material into a solid white. So we have denatured the collagen, the proteins, changing the optical transmissivity, and of course destroying that tissue. So you can envision then that any tissue in the body that we can reach with ultrasound, we could destroy. And so we can use this to treat tumors or stop bleeding and so forth. So here's an example of an animal model. In this figure here, you see an imaging system and a therapy system. The real strength of ultrasound is that you can do imaging and therapy with essentially the same system. So in this particular case, I now will show a movie of a kidney in a pig, a porcine model. And there's a little arrow showing a particular spot. And so imagine that particular spot, there was a renal cell carcinoma, some tumor, a metastatic tumor. And this was in a human, and this person, let's say, had some condition that contraindicated surgery. Now we'll image the kidney and the tumor within the kidney, and then we'll apply focused ultrasound to destroy that tissue. And so this movie then shows, now you see we're actually doing imaging therapy at the same time. The artifact that you see with the fan-shaped area shows the application of ultrasound, high-intensity ultrasound. And you note at the middle of that little arrow there, a bright spot. That's the hyperechogenic indication of boiling. And so now, if we were to sacrifice the animal and to look into the kidney itself, you see that just at the spot we've imaged, we were able to destroy. So this little demonstration shows that one could destroy tumors almost anywhere that one has an acoustic window in the body and use this non-invasive technology to treat cancer. In my laboratory at the University of Washington, we have China Medical Technologies Cancer Treatment System, and we're using this to apply to the Federal Drug Administration to get approval to treat patients for pancreatic cancer. It turns out that pancreatic cancer is a deadly disease. One has the average time between diagnosis and death is about 6 months. There are over 40,000 people who die of pancreatic cancer in the United States every year. And the last 6 months of their life are typically filled with enormous pain that can only be treated by opiates. And so this is a terrible quality of life. You know you're going to die in 6 months, and you're going to experience a terrible pain if you are not totally knocked out by the opiates. So we have demonstrated several times in China. The Chinese have developed this technology, and they have treated over 5,000 patients for pancreatic cancer. So this figure on the left shows a tumor in the pancreas, and this has blocked the ductal valves, the ductal tissue, and there this patient experienced considerable pain. Now, applying then the high-intensity focused ultrasound, guided by the imaging ultrasound, we were able to ablate this tumor in a period of a few hours. And now this next figure, which is a contrast CT system, contrast MR, one can see that there is now no vascularity in the tumor itself. The entire tumor was destroyed. Now, this patient is not cured because by the time one has symptomatic pancreatic cancer, it's typically metastasized to the brain and the lungs and other areas. This patient died within a year or so, but we extended his life a short amount of time. But within a day after we treated him, the pain had gone away, and he experienced a pain-free life until he died. So this is, I think, a very important technology that we are trying to bring into the United States. Of course, this technology then, in terms of using image-guided therapy, has lots of applications. We have tried to take these large devices, as big as a SUV and weighing almost as much, and trying to reduce these in size so that we could build a system that we could take to the moon or Mars. And I show here an example of one system that we've reduced in size in our own laboratory. And this is now the size of a suitcase. Probably still too large to take to the moon because of the weight restrictions, but probably not so small that we couldn't take a system like that to Mars. This system could be used to treat tumors, metastatic tumors, and there is an enormous radiation load in going to Mars. It could treat bleeding. Instead of treating a spot like a tumor, if there were a bleeding vessel, we could stop the bleeding. It could break up kidney stones. And so this is a kind of technology that we try to develop under our Smart Medical Systems team, that is using a platform technology like ultrasound, and then adding different components to that platform technology to treat a variety of conditions that might arise in our exploration of space. Thank you very much for your attention.